who's the SVP and Managing Director at SensisHealth. She has served a number of roles in and outside of healthcare over the years, VP of Marketing for Martin Luther King Jr. Community Hospital in Los Angeles, as well as working with a number of brands outside of healthcare and financial services, lottery, casinos, CPGs, and beauty products. Please welcome Beatriz and our group of D2Cs.
Thank you, thank you. Thank you. I assume you all can hear us well enough. Good morning. I know, I'm always annoyed when speakers do that, but you know, it's been an intensive morning so far. I know that I've been learning quite a bit, and I hope all of you have as well. I also appreciate the fact that those of you who are streaming live are streaming this event, as opposed to other events that might be streamed today. But no more about that. I am very fortunate to be seated here with some very, very smart gentlemen who've done some really amazing things in a space that I wouldn't necessarily describe as new. I believe that these are not necessarily organizations that are creating new categories within healthcare. I really do believe that we're looking at new entrants at existing points of care in the existing system who are coming at it from a different way. And so I hope that you'll enjoy hearing from us. We're also going to be doing this a little less formally, and so some of our panelists are going to speak and ask questions of each other as well. So I hope you'll be comfortable with that, and of course we'll have time at the end. And so to my immediate left is Mario Anglada, and he is one of the founders, or one of the founders, okay, of Ghousheh Health, although I happen to know he did more than most others involved with that. And Ghousheh Health is a phenomenal platform for what has been traditionally an underserved community of Latinos and Hispanic consumers in the U.S. I also am very fortunate to have here Robert Birge from Blink Health, which is another interesting organization in the space. I think they've also brought a level of innovation that is very much appreciated by the consumers that we'll hear about. And finally, but not least, is Ghousheh, who is here representing the organization, spacing out here, I'm sorry, FSA.com plus HSA.com.
Yeah, FSA-store.com.
I'm sorry, FSA-store.com and HSA-store.com. Okay, so you can go back to streaming the other thing now. Anyway, they are a phenomenal organization. Those of you who work for employers that provide the options of FSAs and HSAs will find that this kind of option to be able to understand what you are actually able to obtain under your plan is very beneficial. But I'm going to ask each of them to more fully describe what their organizations do, and so that's where we'll start. Mallory?
Thank you, and good morning, everybody. At Ghousheh Health, what we're doing is we have a very simple mission that is targeted to providing everybody, everywhere, accessible and affordable primary health. And we focus on primary health because we understand that that area is a challenge for the system as it stands today. So our system is built on two main pillars. One is access and one is patient engagement. Access equals cost. We have medication sales programs. We have a program that allows you to buy medication for anybody else in the US and share that via a voucher system. We have the same capability starting in October going to anybody in Mexico. So if you're a Mexican-American consumer and your family lives in Mexico, you're going to be able to buy on our site. We transmit that order to our partner in Mexico, and in 24 hours it's delivered there. So access is one area. We're expanding into nutrition, peripherals, other areas that are adjacent to the medication space. In the patient engagement platform, we're working on two main things. One is telemedicine, bilingual care, 24/7, everywhere that it's allowed by law in the US, internationally into the markets that I mentioned. And lastly, we're working on patient engagement platforms for chronic conditions. So two main areas. One is as a provider support. So if a partner needs us to manage their patients for them, we can do that very effectively and about 90% cost reduction. And number two is if you don't have insurance, then we can provide you a kit delivered directly to your home with everything that you would need for diabetes at a very low price point. Thank you.
Robert?
Very good. So at Blink Health, we're the app for getting the the lowest prices on prescription meds. We're an e-commerce service, so very simply, patients buy online, they pick up at any one of our 33,000 participating pharmacies nationwide. We operate completely independent from the incumbent system, so we have our own network agreements with pharmacies, we have our own technology platform for managing that, we're completely independent of the PBM system, and bypassing those middlemen as an e-commerce service helps us, bring lower prices. And, our customers tend to be anyone who has high out-of-pocket costs on their prescription coverage, no prescription coverage, and in many cases, very good prescription coverage, but a certain medication is, has a high copay on their formulary. So we see all of those folks.
Somebody?
Yep. Good morning. So we operate two web properties, FSAstore.com and HSAstore.com. And our goal is, we have a couple goals. So first is to educate consumers about FSAs and HSAs. So most of us have them, but a lot of people don't really know what they do, how to use them, or even how much money to put into your FSA or HSA. So our sites help clarify that and put messaging out there that helps consumers make decisions to simplify the healthcare journey. So a couple examples on FSA Store and HSAstore.com. You can go on there, you can learn about the FSAs and HSAs, and then we also give you a landing destination in terms of like products to be able to spend your dollars on. So suntan lotions, for example. A lot of people don't know that suntan lotion's eligible, right? I've seen a head shake there. No, I did not know that, right? You can use your FSA card and buy suntan lotion for the year. Tylenol, all sorts of other products. So visit the site, plugging ourselves right now. But
And that's fine. That's fine. That's one of the reasons you're here, right?
Yep.
Ultimately. Actually, I have a question for you.
Yep.
It was an initial conversation you and I had that led to the introduction I gave, where I really feel personally that these organizations that are represented here are not, quote, disruptors, unquote, that we really are looking at entrants who are just bringing a different perspective and a different approach to existing care delivery points. Can you elaborate a little bit on how FSAstore.com
Yeah, for sure.
fits
So
that?
I think when we had our initial conversation, part of it was about the term disruption. And to me, I hear that word, and I don't want anyone disrupting my healthcare. Like I want people collaborating and finding better ways of delivering healthcare. I don't necessarily want things totally disrupted. I don't see huge disruption coming in healthcare. I see technology and a lot of advancements in the way healthcare is delivered to complement existing models. I don't see this huge disruptive thing that's going to go on and just completely change healthcare altogether. I don't know what you guys would think about that.
So you don't think there's going to be an Uber?
I don't think, I personally, and it's probably a contrarian point of view, I don't see an Uber of healthcare. I see precision medicine helping out and doctors using genetics to deliver better treatments to people, looking for ways to drive better outcomes. And then from our company's perspective, we're a consumer-facing company, right? So we're trying to simplify messaging out there. We're trying to get better education out there around healthcare planning. I think doing things like that to maybe drive more preventative treatments and better wellness overall is probably more where the ball is moving, like making healthcare more consumer friendly or consumer centric, as opposed to the old models where it was, you had an insurance card and, if you were sick, you went to the doctor, right? Well, now I think there's all sorts of different options. Do you wait it out? Do you visit FSAstore.com and maybe, you have an ear infection, maybe get like an ear wash, right, instead, and treat it with the ear wash before you go to the doctor. I think that's really where the ball's moving and where the industry's moving, as opposed to seeing this huge like Uber of healthcare.
Yeah,
Robert, your perspective?
yeah, I would just add, I think that's a very refreshing perspective, particularly just because there's just so much hype around tech companies and so forth. And, when you say Uber, a lot of people just go right to so many things that invokes. I would offer a couple of things that I think are perhaps relevant for looking at Uber. First, Uber has faced incumbent challenges everywhere they've gone. The second thing is they've brought market forces to an industry and, enormously grown a category. And I think those are lessons for anyone who's looking at, healthcare and technology is going to face, and certainly one that we face. And I think, disruption has become a trite word, no question. But I think, we feel extremely strongly that in our case, disruption in the classic definition, Clayton Christensen, we are unambiguously disrupting. And, right now, we see the market that we're in, prescription drugs, is, for all intents and purposes, is 20 years behind every other consumer category. If you read Mary Meeker's report, you'll see that 13% of retail is e-commerce. In reality, it's much closer to 20% because she doesn't include travel, which is not classified as a retail category, and it's by far the largest e-commerce category by far. So, for most consumer purchases, 1 in 5 is e-commerce. It's 0 in prescription drugs. And, prescription drugs is actually the one part of the healthcare economy that is a consumer transaction. In fact, it's 90% of the transactions because, you have 4+ billion transactions. And, when you look at what e-commerce has done in every other consumer category, it has disrupted major players. And, this is a category that is remarkably opaque. In all the other consumer categories where you do have, let's call it 20% e-commerce penetration, you have choice, you have agency, consumer agency, you have transparency, and you've been able to bring prices down. And in all of those industries, whether you go through travel, whether you go through brokerage, whether you go through music, all of these industries where the internet economy has come in, powerful middlemen that were profit-seeking have essentially disappeared. And I actually worked in the online travel industry for a very long time, and when I came into this industry, I'd never heard of a PBM. Once I understood what it was, it sounded an awful lot like the GDSs. And when I was part of the team that started Orbitz in 1999, and at the time, there was a GDS, let's pretend it was a PBM. It made more profit than all of the other airlines combined, and Orbitz was actually started by the airlines to disrupt the middlemen. That company today still exists, but it's tiny and insignificant. And, right now we see powerful middlemen that are profit-seeking in the industry. If you look on the generic supply chain, generic manufacturers have never made less profits. The PBMs are making enormous profits, and consumers have paid the highest prices. And so, we absolutely believe that we're disrupting the middlemen in what we're doing, and in a classic sense. But I do appreciate your point for sure.
At Oi Health, we agree with some of what's been said, but what our approach is, we believe incremental disruption is what's going to happen in healthcare. So pricing transparency is an example that was mentioned previously. That's something that when you start peeling the layers back and you understand that once you aggregate consumers, you have bargaining power, negotiation power, all of a sudden the dynamics shift dramatically. So what we think at Oi Health is that we want to be sure we're embedded into the incumbents and we help those incumbents navigate a patient relationship, right? Why does a consumer who does not have insurance, why does that consumer not have health care? We think that that's wrong. Could you get price points down to where a consumer can have a $25 telemedicine consult? Yes, you can. Could you get consumer pricing of medications down to $40 for 60-day supplies? Yes, you can. You can even go lower than that. So our approach is always working within the system to understand, listen, we're here to help. We're here to bring you consumers. Those consumers have a need. You have a solution. But let's take it from a different angle. Let's go into a cash-based transaction that doesn't fall within all the burdens of those transactions that are ultimately navigated and managed by a third party. So if we have a direct relationship with a patient where we can get them their medications, access to care, their peripherals, their devices, and use technology as an enabler, then I think that's disruptive in and of itself. Having a one-to-one relationship with a patient for a particular physician is impossible. Technology now allows you to do that. So that's our opinion.
Thank you. Appreciate that. Interesting nuance in all of that. Now, there's also probably some nuance in terms of your opinions in this regard. Are your target consumers a new generation of consumers? Or are they healthcare consumers, or not necessarily of one specific or a more digitally motivated or digital native population? Do you believe that your targets are a new generation of consumers?
Well, I'll take a first shot at that. I think from a behavioral standpoint, yes. And, there are obviously a number of trends that are pushing consumerization of healthcare. First of all, I think I read nearly a quarter of people who are on employee-based insurance plans are in high deductible plans now, and the out-of-pocket costs continue to rise. And once they get to a certain point, that's going to drive consumers to pay an awful lot more attention to what they're paying, and they're going to look for transparency. Then you have innovation all over. We're three of just countless numbers of companies that are trying to bring transparency and market forces. And as people move online, and when you have players like Apple trying to get people to pay attention to their healthcare on their phone, and innovation after innovation, it's kind of like water. When the internet economy makes its way in, it's going to find its way, and so I think yes, it's a new consumer from a behavioral standpoint, but I think it's going to cross demographic and socioeconomic backgrounds, completely.
Mario,
So in that sense, no.
I see you shaking your head, Mario.
No, I agree. I agree from the perspective of looking at a consumer and understanding what our target audience is. We reach we're focused on serving underserved medical populations across the U.S. That's not a new concept. Everybody who's been in healthcare knows underserveds have always been underserved. So what we're trying to do is we say, let's do something about it. Let's do it in a way where we can bring those consumers, start inflecting that cost curve where it matters. We understand hospital systems work really well once you're sick, once you're inside, but what happens when you're a diabetic, a hypertensive, you have any other chronic condition and you're not supported in the community environment? So from our perspective, what we're saying is we're bringing in a new type of consumer that historically didn't have access to the system, and we're doing it because that consumer doesn't have to go through the traditional model. If you want to come and you want to buy medications at low cost from us, we'll sell them to you. If you want to have telemedicine on our platform directly with a provider that is board certified bilingual, we'll allow you to. So the idea of us creating a system that is parallel and supportive of the traditional model is where we think that that new consumer from our angle is coming in.
Samir, do you have a
Yeah,
perspective?
so I would say I think it's probably a mix of both. So from a new consumer perspective, I think when you think of healthcare, you know traditionally, I spent 16 years in healthcare distribution, working directly with acute and post-acute. And when I think healthcare, I think patients, right? So I say, well, this patient, everybody in the office is like, don't use the word patient, it's consumer, it's customer. So it's interesting. And
you hear that a lot.
And you hear it a lot, but for me, it's at the end of the day, you're seeing a person there, right? And that, like you said, the person's habits, people's habits are changing, right? The traditional ways of delivering healthcare is changing, and so people are out shopping for options, right? They're trying to find, does it make sense for me to use my health insurance to get my MRI, or should I go online and possibly look for a different option to get my MRI that could be cheaper to me because I'm not going to hit my deductible anyhow. And we can get into a lot of stuff about deductibles and the end of the year. Are you going to hit your deductible? Is it worth even applying it to your deductible? Should you just use your FSA dollars and just literally shop it out. So, you know, I think, yeah, customers are changing, and that the habits of these customers are changing.
So it's
overall.
behavioral.
Yeah,
That's what I'm
behavioral,
hearing
yeah,
is the summary.
Yeah, it's more
Okay,
behavior, yeah.
okay. Well, since it's so behaviorally driven, that can get us into the topic of segmentation. And essentially, I don't know, I guess one of the ones I heard was we talk about high out-of-pocket, people with high out-of-pockets, right? People who may not be able to hit their copay, right? And then we have people who are non-insured or underinsured, let's put it that way. So each one of you targets each of those in different ways. Can you talk a little bit about that, how you affect segmentation for your properties?
Yeah, I can start. So our acquisition, our customer acquisition model is very different, and it's unique in comparison to a lot of other e-commerce companies out there. So what we do different is we actually partner directly with TPAs, so third-party administrators, people who administrate the benefit to employees, right? And then we also directly work with employers. So we're partnering with these companies to let them know, hey, you know, health insurance obviously has changed. We've, you know, up here saying it over and over again. High deductibles, they're gonna continue to get higher and higher every year. Let us help you help your employees with understanding how to plan for the FSA and HSA space, and in addition to that, let us help them understand where they can spend those dollars and what they can spend those dollars on.
And do most of the employers you work with have a younger workforce that's healthier and less chronic disease?
So you think of the FSA, HSA space, and the healthcare space in general. I mean, you're on a commercial insurance. You're probably going to be, well, now it's like 27, right? Because a lot of kids are staying on their parents' insurance. So then after 26, they're getting their own insurance. So it's like 27 to 60-something years old based on when somebody retires and then when somebody gets moved on to Medicare, right? So our from an age demographic, I mean, we're serving a 20-something to high 50-something population, and that's our target, right? And if you just look at the workforce in general, the workforce in terms of like the male to female ratio, the female ratio is growing. So 60% of the customers we serve are female, right? They're the caretakers. They're the person that helps everybody at home get, you know, your Tylenol. You can get your, you know, your ear wash, and you need your suntan lotion before you go to school today, right? So I mean, that's how we look at it, and that's kind of how we're approaching it.
The chief healthcare officer.
Yeah.
So. Mario, same question, because to some degree you are, I don't want to say, I'm sure anyone can come and use your platform,
Sure.
but you're very much directed toward Latinos and others who may not necessarily be comfortable with working with physicians who aren't necessarily cognizant of their language or understanding of their culture.
Absolutely.
But is the segmentation a little more refined than that?
It is. It is from the perspective of what we start with is with the idea and the understanding that we build everything English and Spanish from day one, and we build everything with a third grade education level, because we want to make our products available to everybody. If you come in, you like our products, we know you're going to stay. The other thing that we know is that there are subsets of the population that historically have had less access to healthcare in the traditional model. So our focus of Hispanics is by design because of the need, but more importantly, it's because of the opportunity. When you look at the demographics of the U.S. and you look at where the U.S. is going in the next 25 years, a lot of the growth for the U.S. comes from the Hispanic consumer. The other thing that we also understand is that we're not going to be able to achieve this on our own, so we do partnerships. And we are agnostic to our partner as long as that partner has a shared mission with us. So our partners today can include a trade union, a hospital system, a retailer, that's a pharmacy, a supermarket, or it could be people in the community who say, listen, I have a church and I really love what you guys are doing, and we want to expose our members towards it. It's really critical when we engage with our consumers, you have that aha moment, and the consumer's like, wow, I didn't know you could actually do this. And that was, for the team, really eye-opening, but the really, really eye-opening environment that we went is when we start partnering with institutions and you see healthcare professionals who have spent their career doing engagement with consumers and they understand what you're trying to do. Some of them are like, this sounds too good to be true. Is this possible? And the answer is yes. So we focus on the partnerships to drive that healthcare professional engagement. Once they understand what we're doing, they become our advocates, and we also go after the consumer in a bilingual fashion in the US, but specifically focus on the Hispanics for the reasons that I mentioned.
Thank you. Robert, I have a specific slant for you, though.
Okay, go ahead.
I'd like you to talk a little bit about the Blink Health Nation.
Sure. Let me start with the segmentation question. It's funny we talk about this. As a mission-driven company, we have a corporate philosophy of humans first. We strive to lower prescription drug prices and make them affordable for everyone, which in a way is philosophically contradictory to segmentation. But we approach marketing in general in the same fashion we approach building product, which is fast iteration, extensive use of A/B experiments, and a lot of investment in measurement. And so, segmentation flows out of that as opposed to segmentation up front, though we do plenty of that. In terms of your question about, Blink Health Nation, we have the fortune of our patients, and we do use the term patients, thank you for making that distinction. Our patients and also providers, they spread the word very actively for us, and we literally have thousands of people send us videos that tell their story on selfie cameras about what having lower prescription prices has done for their families and their lives. And we've just put those together to allow people to share that. But it gives us great tailwinds from a customer acquisition standpoint, because the social diffusion, so many American families are struggling, and we have providers who tell us that, which is amazing to hear, that people literally choose between meds and food. And so when they find something like Blink that can save them so much money, they're very apt to share that. So that's Blink Health Nation is really just celebrating that and helping people share their stories and spread the word.
It's wonderful for generating testimonials. It really is.
Thanks.
And do any of you want to ask each other questions? And if the answer is no, that's okay. We'll open it up to everybody else.
We have a lot more people out there.
Yeah,
We do. Is it premature to open to the audience? We have limited time, and we'd really love to hear from you. Questions?
Hang on.
This one way in the back. Thank you.
Hi. This is on. Zara Castor with Experian once more. This question is for Robert. So I love what you guys are doing at Blink Health. I think it's amazing. As you grow your business, are there any ambitions to tap into that data and utilize it for measurement? I mean, right now you have, 2 organizations that you can go to for this. So just curious to see if that's something you guys have thought about.
Could you just clarify?
Sure. So for measurement for ad effectiveness.
Measurement for ad effectiveness of what?
Of prescription refills.
Yeah, I'm sorry.
With you guys, you're seeing all these prescription refills, correct?
Yeah.
So you're getting all that information, right? The scripts that they fill, who they are. So there's organizations out there, right, like an IMS or a Crossix.
Do we consider monetizing the data of our patients' behavior?
For measurement purposes.
Yeah, right now that's not something we're at all looking at.
Mm-hmm.
Now I understand your question. So I think the answer is no.
Okay. Yeah. No, it's just curious to see.
Sorry. Yeah. No. Of course.
Okay. Thank you.
There's a question up front.
Oh, go ahead. Hi, Amy Fries with Be The Match, and I just was curious to understand. You haven't really talked much about how you're marketing your in D2C in terms of, digital media. We want to just share a little bit about some of the strategies you have to reach consumers and What's been successful?
You're asking me?
I'm asking anyone.
Oh, yeah, sure.
So we engage with the consumer through a variety of vehicles. The community is a starting point because we understand that the community engagement and that interconnectivity of the federally qualified health clinic, the doctor's clinic, the hospital is a good starting point to interact with consumers. After we do that, the direct-to-consumer engagement happens on social media for us. Hispanics tend to be over users of technology and social media and the like, so we found that that channel is a very effective one for us to be able to communicate. Where we're at right now, those are the two primary elements of engagement. Over time, what we're planning to do, and we do use our data for purposes of getting the consumer to understand their condition. Right? So the idea is, once you buy a prescription, we understand what you are buying it for, then we can internally, and we don't monetize it externally, we use the ability to offer you other products and services that we know that you might need based on that. We're a HIPAA-compliant company, so the consumer engagement happens from that perspective internally. And once the consumer is exposed, then we use all the information that he or she allows us to use in order to provide them better service.
So it looks like, or at least what I'm hearing is so much of this is organic.
Yes, it
as
is.
opposed to paid?
It is right now. All our partnerships are unions, trade groups, governments, hospital systems across the nation that have seen the ability to integrate our products and services. And one thing that we do is that we are bi-directional with our partners. We want our partners to be able to generate the information that they need from our customer base, or if it's a shared customer, we have interconnectivities into their electronic medical records and the like. So our relationship is based on an organic growth through the understanding of what the challenges are of our particular target at this point in time.
I'd love to hear about the paid strategies. The paid strategies from the rest of the panel.
Yeah, I think she wants to hear about paid strategies. Don't blame you.
Yeah, you know, I think we have a similar finding to Mario. You know, a number of things that are very successful for us have as much to do with, you know, facilitating the social diffusion that's happening. You know, we get quite a bit of inquiry from providers, and you know, we work hard to support their needs because our interests are so aligned with so many of them. Social media is very, very effective for us in a variety of ways, both paid and organic.
Now, I just want to add on to that question. In terms of the relationships with providers, would you say that you are a medical marketer in any way? Do you make any investment in medical marketing?
No, we don't.
Yeah, and so I'd mentioned our strategy is a little bit different from traditional e-commerce, right? So I mean, we're developing partnerships with, you know, again, with the TPAs and the employers on the front end, and we're providing tools and content that can be pushed out to the employees through email, through HR portals. Oops, sorry. Did you guys all miss that? Through emails, HR portals, and then through our learning center. So we're constantly trying to touch these employees as much as we can with the help of our partnerships in the HR departments, right? And then drive them back to the site to be able to get our messaging out, and then also, you know, obviously capitalize on the FSA, HSA spend.
Over here? Yeah, go ahead.
Thanks. Robert Kadar from CMI. Question for another Robert here. You might have answered, which is you don't do medical marketing. Did you mean marketing to HCPs? Because a lot of physicians are concerned about affordability issues, and it could be a way to grow your business, grow your brand, if there was some level of awareness among physicians that they could recommend to their patients that they use your service.
You know, I probably misinterpreted the question. You know, we do market into the provider channel.
Do you actually invest?
I'm not sure what you mean by that.
Do you spend money in paid media toward physicians?
We do.
Okay.
We do.
Hang on. Go ahead.
Matt Hedberg, Semcasting. First of all, just want to thank all three of you for what you're doing for consumer pricing transparency. It's, you know, nice to see in this industry specifically. I guess my question is, looking to the future, the kind of disruptions that you guys are making in the industry as a whole, where do you see some of the potential regulatory changes coming into play? I mean, for you, Robert, specifically, any changes to the safe harbor provision for PBMs, I guess, specifically?
Well, I think, you know, certainly in the branded space, the more that there's transparency there, you know, I think hopefully will help make it easier for all patients to get, you know, the most affordable branded meds that they can provide. And, you know, anything that will improve that. You know, I think, you know, I personally believe the PBMs are extracting unambiguously monopoly rents from that channel, and you know, I think, you know, the more that goes away, I think pharmaceutical companies would very much like to have a more direct relationship to consumers. And, you know, as the internet economy comes in, you know, the people that add value in a supply chain tend to do very well. The people that don't add value tend not to. And you know, I think, you know, I think that will play out in a way that will benefit anybody who's working toward market forces in the economy, direct consumer access, transparency. And so, yeah, I do think that will be a good tailwind for us and anyone like us who wants to end the opacity and you know, monopoly profits in the middle of the supply chain.
Samir, I would like to elaborate on that question with respect to, I like the look on your face. It's like, no, don't throw that one at me. It's an interesting and, let's say, not so certain future for health insurance in general, both on the public and the private side. What are you as an organization doing to sort of protect yourself against any, let's say, if HSAs become less viable or less desirable, same with FSAs, just we know that there's some potential fluctuation in the design of our health insurance market.
Yeah, I mean, and I would say there's definitely a lot of noise in terms of you know, what's going to happen with FSAs and HSAs. What I would say is that if you look at healthcare, and I'll keep going back to this, it doesn't change overnight. It takes a very, very long time. So for someone to just, you know, take a pen and say, oh, FSAs and HSAs are gone, that would be really hard for most of America to swallow, right? I mean, you have right now 40 million HSA and FSA accounts that control pretty much, or that could be spent on about 115 million Americans, which pretty much means every family in America has some type of access or is touched by an FSA or an HSA, right? So, you know, I don't know how to prepare for the headwinds of government, and if any of you have any ideas, but take my email and please email me. So I don't know. So really, I mean, again, we're just trying to push messaging out to consumers, help them understand the importance of it, help them understand that, look, you have tax advantages by using these accounts. You want to continue to use them, and hopefully that messaging will continue to drive the adoption of FSA, HSA, and more consumer health care practices in the future.
We have 4 children in my family, so I sure hope FSAs stay. This is the first thing. Thank you.
If I can add something that's important to realize is once you start consumerizing healthcare, peeling it back is going to be really difficult, because once that consumer understands what the capabilities of their self-interaction with a healthcare professional, what the true cost of access, drugs, peripherals, and devices, you're going, I understand your question, but I pivot it to a little bit of thinking about once you have a direct-to-consumer relationship, if that consumer is engaged with you, if your products and your services are top quality, if that consumer can at the end of the day utilize you as a parallel or alternate to what is the incumbent, most likely the headwinds are going to be beneficial for anybody who's trying to disrupt in a way that is systematic and well thought out.
We have another one here, Ann.
Hi, Andrew from Cicerone again. I'm a rabid free marketeer who is attracted to universal health care and a single payer system. like many consumers. Would your business models have a place in Canada or Europe or elsewhere? Are you solving a problem that works uniquely in the American healthcare system? Or do you, say a Bernie Sanders were to come along and win and all these other things happen, how does your business model work if we go through some sort of monumental shift towards either single payer or something like it?
I would just say that I'm not qualified to answer that question, but I would say as a committed free marketeer as well, I don't think there's anything free market about what you've described. Free market to me means there are no third-party payers. You know, the idea of a third-party payer to me, as someone who's fairly new to the healthcare industry, is a little bit crazy once I understood it. I mean, the idea that, you know, someone sells me a bunch of prepaid services and then their business model entails making sure that I consume as few of those services as possible, and putting hurdles up in front of those possibles is as far from a free market concept as possible. And I think a universal payer, to me, appears, just as the economist in me, is simply another third-party payer. A free market means there are no frictions between the buyers and the sellers. And I think anyone who's up for a free market system wants people to be able to go and shop for their healthcare services like anything else. I pay for my own oil changes, but I have insurance for, if my car is totaled. Even calling this insurance to me is a little bit odd because it feels a little bit more like prepaid, overpriced healthcare to me.
If I can add something there, that it's important to understand where your focus area is, right? So OiHealth's mission is to provide primary care everywhere to everybody. So the idea is, can we get to a place where you interact with the physician directly, that physician gets paid a livable wage, and then the consumer has quality health care? Could we add and extend that to medication and to devices and to other ancillary services? The answer in a single payer model is yes, we can survive because we will be an efficient player within that system that ultimately drives down costs for incumbents. If you specialize, knowing that, one, your consumer is king, he or she. Number two, that you have to drive transparency and value to that consumer. Most likely, I think all three of our companies are able to be positioned into an environment where radical change might take us tweaking of business models, but it doesn't take away the value proposition of going after pricing transparency and costs that shouldn't be in the system at this point in time, at least in my personal opinion.
Beatriz,
my
panel.
answer is yes.
Panel, thank you very much.
Thank all of you.
So these folks graciously handed us off onto the topic that's going to begin our